I'd be happy to. So I've got about 10 slides here, in part because it's super early to help me make sure I say everything that we ought to cover and get on the same page here. So if I'm able to share my screen, I think I'll start with that. And then we will go over to Tom and Judy so that they can help me cover anything I missed. Are we able to share our screens in this meeting?
Yes. Should be able to.
Okay. Looks like it might be disabled for folks that aren't the host.
Oh, okay.
I think there's settings right next to the share screen. A little
There
arrow.
is one participant can share at a time is checked. And then multiple participants can share simultaneously. We don't want that. Only host all participants. There we go.
All right.
Okay.
Welcome to everyone watching at home. We're having fun with Zoom.
I think I've got it. It's one participant can share at a time and it's all participants.
Yeah, you should be able
You
to.
have it now?
Beautiful. Yeah, that got it. Thank
Awesome.
you, guys.
Beautiful.
We run weekly all hands calls with SST volunteers on Tuesdays. So we do plenty of this ourselves. It's good fun. All right. Thank you guys very much for the opportunity. I'm Daniel Curtis. I try not to take the title executive director too seriously. We are all volunteers in the senior support team. We have actually never handled a single dollar of cash on the senior support team. We have literally zero funding. Get that question a lot. But I think we've put together a interesting and valuable volunteer network to support long-term care facilities. So I'm going to go through an operational overview and some notes on our purpose so that we're all on the same page. Folks that had an opportunity before the meeting to look at our one-page summary will find a lot of this very familiar. And then Tom and Judy can help me fill in any gaps I missed. And then at the end, I think one of the topics I'd really like to hear about, since we have such an interesting range of stakeholders here and we'll have some time to discuss, is your feedback on where could volunteers or better communications help you? And where could volunteers or better communications help out your little corner of the senior care industry? All right, so we've got a lot of folks in here I know that have been working on the front lines, supporting seniors, fighting their way through the pandemic. So thank you for that. We never want to miss an opportunity to be very grateful for that work. The senior support team is 100% here to help. That is our sole purpose. So I want to talk about some of the fundamentals of what we do and how we do it. We've got a little bit of history in here to help out with context. I've got a couple of notes here about our key volunteers, some of our leads and specialists that have helped build up the senior support team program. A few notes about our communication channels and tools that help us do our work day by day. And then some numbers to help out with context and history of how we work and what all we do. So I've started with our mission statement here. This is right at the top of all of our one-pagers. The goal of the senior support team is to support assisted living facilities, skilled nursing facilities, and other senior residential facilities in New Hampshire by providing actionable information when they need it, monitoring their status daily, and advocating for any supplies or services that might make COVID-19 outbreaks in their facilities less likely. And I alluded to this earlier, we are an all-volunteer team that operates 100% remotely and has all along since our beginnings in March. So how do we do it? A couple of key things about our operating model. We have a crew of volunteer liaisons who are available to communicate with their long-term facility contacts daily. Volunteer liaisons, and actually folks in most of our volunteer roles operate in pairs so that nobody needs to be on duty 7 days a week, so that everybody's got a partner they can switch off with, and so that they're always available. We want to be available 7 days a week, whatever might be happening in your facility. We want to be there available to talk about it and available to put it on daily reports so that that information gets where it needs to go. And volunteer liaisons currently tend to have somewhere between 3 and 4 facilities assigned to them at any given time. We track a couple different kinds of key data, especially the details of PPE requests sent from our participating facilities to the Department of Health and Human Services. We found that tracking those in detail has given us a lot of insight about what's going on with the supply system and the infrastructure and how well supplies are actually flowing to where they're needed. We have found some specific problems with that and worked very quickly with DHHS and the facilities to fix them. And then we send summary reports about what we found and new questions that have been asked of us every day to senior DHHS staff. So that helps enable that rapid, specific communication to address new issues. So how do we help with actionable information? So we believe that daily communication helps provide very frequent opportunities to discuss whatever is current, whatever is on your plate right now, urgent questions and new issues so that they get addressed right away. They don't linger for days or weeks not getting dealt with. We put new questions from the folks we communicate with on daily DHHS reports, and then we make sure that our liaisons and the regional coordinators that back them up get the answers and help make sure those answers get to the folks that need them each day. We maintain an FAQ library so that we can keep track of all the information we've accumulated, which includes both the latest guidance documents so that we're on top of new official guidance and answers to questions that we've received from state officials over time so that we're always building up more wisdom and so that we minimize the amount that we have to ask the same question over and over. Folks that have attended those Wednesday conference calls with DHHS will know what I'm talking about there. And then SST leads and specialists get together every day to review liaisons' notes about what they've heard on their calls and review new questions to figure out if there's anything special or unique that we need to follow up on in a different way than our normal daily routine. So monitoring status, I think our key here is that we want absolutely no one fighting a pandemic to ever have any surprises. We don't want any of you to have any surprises. We don't want DHHS to have any surprises. We want to make sure that the flow of communication is good enough that questions are getting answered quickly. No one is ever surprised by a new development. So liaisons can help identify relevant guidance or relevant authorities to get in touch with when a new issue arises, and they're available to do that again every single day. The daily reports can help ensure that state officials have higher visibility into what's going on in the long-term care industry, what kinds of issues are being faced, so that again, a new issue doesn't linger for days or weeks not getting dealt with. It's seen immediately. And our data tracking, especially on PPE requests, helps ensure that issues get noticed and addressed quickly. This is one where I think we have made a whole lot of progress since we got started back in April and May. Back in April and May, we saw a whole big list every day of PPE requests and folks that were really worried about their supplies and were not completely sure how fast is the system actually going to respond? When am I going to get what I need? We see far fewer questions now. We can see directly in our daily reports the system is working a lot better. And we can see on our daily calls that when we put down a red flag on PPE supplies in a statewide report, the state is right on it, calling the facilities that need help and following up immediately. And I think we consider that a major improvement and a big victory for everybody involved. So advocating for supplies and services, these all dovetail together. So our daily reports are an opportunity to help prioritize and reinforce key issues. We talk especially with our regional coordinators about that regularly, about their role, taking information from the liaison notes and helping us prioritize, figure out what's a big issue, what's a new issue, what needs new action to address it. So we have data that, as far as I'm aware, is unique in the state of New Hampshire on staffing and supply issues. And we have periodically provided state officials with special reports to help inform major decisions. One of the big ones that's been on our radar is the possibility that DHHS EOC supplies might get scaled back at some point. And so we have been providing information about questions we've asked our facilities on private PPE supplies and private orders they've placed to help make sure the department is really well informed about the environment. To make sure that they know that at least among SST facilities, only half have confidence in the private supply chain. And that's been pretty steady all throughout the summer. And we think that that really ought to inform their decisions about the availability of supplies. And then we've also done our very best through meetings like this and through meetings with the industry associations to help connect facilities, industry organizations, government officials, a couple of nonprofits and other specialists we've worked with to help address big issues. One of the things we had a whole series of meetings on with a couple of folks working on grant programs and with LTC industry associations was staffing. What can we do to make more LNAs available to long-term care facilities? We've had a whole series of meetings on that. We've worked with folks at NH Needs Caregivers. Several of you may have heard about that program that helps with LNA training specifically for skilled nursing facilities. So we're trying to get out there and help make connections like that. And of course, our liaisons in their daily calls are in a position to inform their facilities immediately as soon as we identify a new resource that it's available to them. So a little bit of history about how we put this program together. You've heard we have kind of a two-part name, the COVID Alliance Senior Support Team. So the reason for that is that we got started back in March as the COVID-19 Policy Alliance. So this was originally founded by a set of MIT faculty, mostly actually in the Sloan Business School, who advocated for centralized COVID command centers. So we first proposed this at the federal level and then reached out to governors to propose it at the state level. The basic idea here was to tie the command center into telehealth systems. So the state would do whatever was necessary. It's an emergency, build, buy, or steal a telehealth system, tie all the data into your command center, advertise the availability of it to everyone in the nation or in your state, and make it clear that that is the first place folks should seek help if they suspect they've been exposed or they have COVID symptoms. This would have enabled both folks that are afraid they may have COVID and doctors and nurses to all work remotely, minimizing contact, and it would have made sure all the data was in one place. It would have been quite elegant. I'm very proud of our work on that. It went nowhere. So that proposal went absolutely nowhere over about 3 weeks of work. So later on in March, we pivoted quite a bit to thinking about what can we do more directly. We know senior facilities are about to get hit hard by this virus. We had done some of our own data analysis. I think a lot of folks were figuring this out in March. That wasn't a unique insight at that time. So how can we help directly? And late in March, I think a couple of ideas came together that were largely inspired by political campaigns. So that's where my professional experience more recently is at. I actually had very limited medical experience before the COVID pandemic. More recently, I had been working on political campaigns, and then before that in academic research. So our model was inspired by the ability political campaigns have to recruit a lot of volunteers, get them to make a lot of phone calls, and hopefully, if you're doing it properly, build personal relationships, either on a campaign between your organizing staff and your volunteers, or in the case of the SST, build relationships between our volunteer liaisons and their facility contacts. Excuse me, it's early. My throat's feeling scratchy. I'm sorry about that. So a little bit more history here. We spent the first half of April trying to gather stakeholders, talking to state officials, talking to the industry associations, gathering medical advice. Since I do not have any medical credentials to my name, one of the things I spent the first half of April doing is basically writing down every single thing I was told by anybody that did have a medical credential about the right questions to ask and how to support folks in long-term care facilities. And of course, we did a lot of volunteer recruitment. So our liaisons began calls on Monday, April 13th. So that's a date I'm going to remember fondly for a long time. Daily reports to DHHS officials began on April 17th. And then we rolled out the comprehensive supply tracking process I've alluded to a couple of times on May 4th. One of the glitches we found here, so I didn't write this one down, but this one feels to me like a major victory. We promptly figured out in early May that DHHS was, at the time, was closing out any supply requests they received anytime they partially filled the order. So if you asked for masks, gowns, and gloves, they delivered gowns. They closed out the request and took no further action on it. That was their standard procedure in early May. And we found that in early May, there were a lot of facility administrators that did not know that was the case and really needed a liaison to help inform them about that and help identify times when they needed to make additional requests. So that one felt like a big victory for our system of rapid communication. So some of our key volunteers, you know that State Senator Tom Sherman is here with us, the chairman of the SST effort. Judith Joy here is our statewide volunteer coordinator. She has a lot of experience helping run nonprofits, nursing associations, and before that had experience as an Army nurse and working on medical information systems. We've also had State Representatives Polly Campion and Jerry Nurk working with us. I was absolutely thrilled when Polly Campion signed up to actually serve as one of our frontline liaisons back in April, and she worked for many months in that role. Paula McKinnon, who some of you might know as the New Hampshire School Nurse Association president, was formerly our operations director, helped us put together a lot of infrastructure like our website and the web forms we use for the daily calls that our volunteers make to facilities. And I may have duplicated some notes about our liaisons this morning. So we have a lot of veteran nurses on our team, especially school nurses. As it happens, back when we were recruiting in April, they were obviously not going into the office. And the New Hampshire Nurses Association has been really a big partner for us in volunteer recruitment. We've also had MIT student volunteer EMTs. They have a volunteer EMT service on campus there. We've had some Dartmouth medical students. We've had MCPHS students, especially from the physician's assistant program. And more recently, we brought on board quite a few Seacoast MRC volunteers. So definitely a major thanks to anyone we have here from the Seacoast MRC, because they've been a big help on volunteer recruitment over the last couple of weeks. So some of our communication channels now getting a little bit closer to the nuts and bolts of how we do what we do. We have an initial contact survey. That's our tool for new facilities to sign up to participate in the senior support team program. We have a daily update system that actually sends out automated text messages every day at 9 a.m. So folks that are signed up as SST members, I know we have a couple in the room, you'll be getting your daily text messages in 17 minutes. And then those text messages are recorded and made available to our liaisons so that they have a little bit of context to help them triage and understand what they're getting into with their calls each day. Our questions are very simple, yes, no type of questions. Do you have any new COVID cases today? And do you have any other new needs? Aiming to be a quick tool to help understand the situation out there. This was developed in collaboration with actually a research lab at the business school at MIT. So it was a big help when we were getting set up. Of course, we have liaison phone calls available every day, and sometimes emails and some other kinds of informal communication so that liaisons and their facility contacts can stay in touch with each other. We have a weekly newsletter. So our most recent newsletter, I believe our 18th, just went out yesterday. And we have a website and that FAQ library I mentioned earlier, where we accumulate all of the wisdom and answers that we've collected over the last now 20 weeks of operation. So by the numbers, just a little bit more context on what we've been doing and where we're coming from. As of exactly 1 week ago today, the liaison program's now been operational for 20 weeks. We currently have, by my latest count, 46 liaisons and 8 regional coordinators supporting 55 facilities. Looks like I've got a duplicated note in here again. Wanted to make sure I didn't miss anything. We have 13 volunteers in leadership and specialist roles, folks like Judy and her deputies. We have a 13-member medical advisory group, which includes some veteran long-term care medical directors and infection control specialists that help to do things like write scripts for our liaisons to help guide their calls back at the beginning, and recently helped us complete a major review and update that's going live tomorrow to help make sure our liaisons have up-to-date material. We've delivered, as of a week ago, so this is a few hundred calls out of date, over 2,100 calls to our participating facilities, and we've received over 15,000 of those daily text messages, keeping track of facility status. All right, so kind of wrapping up with where we are at today, we are happy to receive new initial contact surveys from new facilities. We will connect folks with liaisons as quickly as possible. I do want to be clear where we're at, though. We are also eagerly seeking more volunteers. So the reopening of the state over the summer, and especially the upcoming reopening of schools and universities, has affected our volunteer availability quite a bit. Our folks are back to having busy and often full-time schedules, which makes volunteering more difficult. So we are eagerly seeking more volunteers. One of the things we've discussed with a couple of the MRCs already is the fact that there does exist out there a pool of volunteers, especially the folks over 60 at higher risk of infection, that really haven't been able to get engaged in other ways. We have quite a few veteran nurses on our team in that demographic who have been able to help out and fight back through the senior support team. And that's an opportunity that we want to make sure folks are aware of, because we know there's more volunteers out there that can help us sustain this work through the rest of the year. So with that, I want to turn things over to Tom and Judy to help me fill in the gaps, fill in the things I missed. I think I mentioned right at the beginning, we've handled $0 in cash while we've been working on this program. We've had a couple of our volunteers and a couple of vendors provide software tools in kind. I've mentioned that our liaisons typically have a web form open during their conversations to help guide the conversation, to make sure they have resources available right in front of them, and to help record some data about what's going on at the facility so that we can stay up to date. And also we have all volunteers sign a confidentiality agreement. So that our data it's not being shared with researchers. Nobody is profiting off of this data. This data is going absolutely nowhere other than to our leads and specialists and government officials who can help, who can use that data to help long-term care facilities.
So Daniel, I'll jump in there. This is Tom, and that was a great overview. As many of you have probably experienced in your own volunteer careers and work careers, a lot of what happens in the world is just, I guess the best word is dumb luck. And the way this really got started, it was the COVID Policy Alliance was a group of MIT professors, as Daniel said. And one Sunday evening, I got a call from my niece, who was one of those professors, and she said, "We have some questions about PPE, and you're a doctor, so we'd like to ask you those questions." And I think that same evening, I was on my first call with the COVID Policy Alliance answering their questions, and then they made me their chief medical officer. So it's been that kind of sort of kismet as we put this together, and Daniel bringing the organizational skills of a political campaign to this campaign has been beyond incredibly valuable. I mean, we would not be here without his work. But just to underscore a few points, the first is that SST is not political. This has nothing to do with politics. I'm a state senator, but this is all about, the goal of all of this was to blunt the curve, as we've said many times throughout COVID, and make sure that New Hampshire was completely ready, or as completely ready as they could be, especially in the most vulnerable populations, which were the elderly, and especially those in senior residential facilities. The initial focus of the COVID Policy Alliance, because of the reach of the people, the professors, was national. And much of that was not adopted, but there was an awful lot of it that was, working with California, New Jersey, North Carolina, Connecticut, Massachusetts, Maine, and New Hampshire. And I was really the liaison to New Hampshire because of my work in the state, as well as being chair of Senate Health and Human Services, and also being a physician over at Exeter Hospital. So the focus became regional, and the COVID Policy Alliance has been a game changer in Massachusetts, and also has had influence up in Maine. In terms of the daily reports, who gets these? These go to the Emergency Operations Center. They go to Jen Harper, who's the Director of Emergency Operations. They go to Lois Shibonette. They go to the Director of Public Health, and to specific people who can answer the questions that we ask on a daily basis. And I send those and follow up on them. I just want to underscore one of the really unique aspects of this is the daily text message, which was developed by MIT, as Daniel said, by one of the participants. And it's really quite an amazing tool, which they have used in other states like Georgia to help create a system for balancing beds across the state. So this is a unique tool to the COVID Policy Alliance that has been used for other purposes as well, with incredible impact. What we've done is we've rolled with areas of concern. So when reopening was the big concern, and many of you know, reopening included restaurants and venues and beaches, and the COVID Policy Alliance was completely in touch with what was reopening and possible impact on senior residential facilities. And in our latest newsletter, a lot of the focus has been on upcoming elections and school reopenings. And you say, well, how could that affect a senior residential facility? And the fundamental is that COVID gets into these facilities through the staff. That's staff and vendors. And staff have children. And so the impact of going to the polls or having your children in school will be felt by the nursing facilities. And we are trying to be a step ahead of that. And finally, who participates? The participation is completely voluntary by the facilities. We've had up to 71 facilities participating. There are currently about 225 licensed senior residential facilities in the state. We have continued to work, and Daniel mentioned this, but I just want to underscore this. We work very closely with all three industry associations to be sure we are dovetailing our work with them rather than competing with them or doing things that they would rather we didn't do. So it's been very nuanced involvement with, in association with those professional associations, as well as with DHHS. And I just want to take my hat off to Daniel and Judy and all the volunteers, and Joan Widmer from the Nurses Association and Paula McKinnon from the School Nurses Association. And then the level of knowledge and professional expertise of our medical advisory board with Jerry Knirk and others is just amazing. So again, and just the final thing is to underscore Daniel's call for volunteers. We continue to look for volunteers. It's incredibly rewarding work. It is not a huge time sink. And I think the senior support team has been instrumental in making sure that the facilities are fully supported as they have fought COVID. So thank you for allowing us to present.
A really good segue. Thank you, Tom, to talk about the, what we expect of our volunteers. In the first place, we have a lot of tools, a remarkable number of tools for them to use. And the tools include not only access to our fact library, which is public, by the way, but also the newsletters that we send out. And as many of you know, all of you are in healthcare or closely associated. We're big on closing loops. And so that's one of the things that we do that that perhaps and Senator Sherman, maybe you can back me up on this. The state is not always really good at closing loops. And so we did a lot of that. We did a lot of that to begin with. We tried to make sure that connection between the state processes and our facilities were tight, and that we could give people some reassurance by providing them information that from the state usually that helped them be a little bit more confident and comfortable that they were doing the right thing, and that they were able to provide the PPE that they needed and so forth if it was available. Our liaison pool, incredibly dedicated group of people. We require only an email level of online capability and that's important. Many of our volunteers have not been like Daniel. I kid Daniel all the time. because he says, oh, it only takes 2 steps. And, I'm saying, no, Daniel, it only takes 2 steps for someone who's, your vintage. Um, for someone my vintage, it sometimes takes a little bit longer, and so we've been very careful to make sure that the tools that we use are easy to use, and that we provide a 90-minute orientation to the tools that go through through all of our tools, piece by piece. And so people who are joining us, I think, feel fairly comfortable in what they do when they get to talk to facilities. The other thing is, we've mentioned before, is that they're never alone. We don't throw people into the volunteer pool and say you're on your own now. We have a cadre of statewide regional coordinators who are there nearly solely. They do some reporting and that, but their main job is to support the liaisons at the pointy end of the stick, so to speak. So that they're never out there. And in fact, the pointy end of the stick has been very pointy at times. We've had facilities who have been in absolute crisis, who have been, who have had reporters on their front lawn and wanting to know, what is out there for them to help them. And they've been on the phone for an hour, although that's not usual. They've been on the phone for more than an hour with one facility. That's very uncommon. Our calls are usually, our liaisons usually put in less than an hour a day, and that's every other day, or however they arrange with their partner to do their job. So that's that. Filling in kind of the blanks about our volunteer cadre, and again saying that we are looking for volunteers. We're actively recruiting, and we're ready to orient people and put them to work. And especially right now, many people in the state are getting very relaxed. We've been very lucky in New Hampshire with the number of cases and the number of deaths that we've had in New Hampshire. I mean, no death is a good death. But we've been spared the major crush that many other places have had. But we know that school opening and the continued relaxation of masking and is going to have an impact, along with that voter exposure. So we want to be ready, and we're hoping that you can help us.
Yeah, thank you, Judy. Thank you, Tom. I think that's pretty well covered what we had to present. So I think at this point we are open for questions, comments, volunteer leads, whatever might be on your mind.